we really need to attend to the issues of well-being of our inmates. But then there's the side of offenders. There is a case of one of the offenders in this facility. I don't want to mention the name, but it came out in the newspapers some few months ago. One of the things that he is mentioning is that incarceration has affected him mentally. His well-being has been affected. So it is a fact that the conditions that prevail are inherent to the fact that a person has been incarcerated, inherent to the fact that a person has been sentenced. That is in its own way has an effect on the mental well-being of the person. But there's the positive side of it. The positive side is that there's one common denominator, and that denominator is the fact that when an offender wakes up every morning, the first person or the first living organism that they interact with is a correctional official. If we are able to address this issue that we are dealing with today, the issue of mental health care on the side of our own officials, automatically it will yield positive results also on the side of offenders. So we deal with these mental health problems on a daily basis: depression, anxiety, substance abuse, job stress. From a human resources perspective, you can simply assess that from the amount of days that a person would want to be away from work, the amount of days that a person will be at work or not productive. You can also assess that from the number of disputes that would arise from that person interacting with fellow employees or supervisors, or that supervisor actually generating disputes from subordinates. So those are the things that we have to look out for, and we need to, as a department, be sensitive to addressing them. We have agreed here that we are going to have this session again next time. The question then will be, out of the recommendations for this meeting, will we be in a position to confirm when we meet again next year that we implemented 100% of those? So I will start with my part. My part is that those recommendations, when they come to my desk, they will be approved, there will be a budget against those recommendations. The second part of my part is that I will start collecting. So before I come again and attend this session, I will have collected the 100%. So it means you would have done 99%. Now I'm just going to do that 1%.
To us as the Department of Correctional Services, this is the first one of its kind. And what happened is that we did this because our officials have gone through all the challenges. We had COVID, they've gone through that, they've been taking care of offenders, and they were also subjected to the COVID-19. So hence we said, let us organize this mental health care. And the theme for this mental health care summit is that we are taking care of the mental health and well-being of our offenders. So that should be a priority as our healthcare professionals. So what we have organized here is that we do have representatives from the regions, and from the regions we focused more on the development and care. That is the regional heads development and care, regional coordinators development and care. We have also called our spiritual care workers, our social workers, our psychologists. We also have our medical doctors in the midst. We have our pharmacists. So all mental health care professionals have been invited. But as you know, as a department, we were not able to get everyone in one place. So we got representatives from different sections. So we have invited the Department of Health, the National Department of Health that we are working together with. We've also invited the University of Pretoria that also came and presented, because we are working together with them as our stakeholders and partners in terms of healthcare. So for the 4 days was a successful event. This was successful in the sense that We have taken them through the legislation, what is happening within the department and even externally in terms of the legislative framework that we need to implement. We have also taken them through our policies and procedures and also our standard operating procedures. And what is critical out of this session is that we have realized that as professionals, some professionals are not aware of what others are doing. Let me give an example. You'll find that doctors, they don't know when to refer an offender to spiritual care or to psychologists. But having all those professionals presenting and educating others about their responsibilities, their role within the department, it made clear that as professionals, we really need to work together because our common denominator is our offender. So all professionals, all multidisciplinary team, we need to come together and work together as a team. So we are going to evaluate this event, evaluate this for 4 days, so that when we do another annual event, then we'll take it to another level because this has been our first mental health care summit.
It has given us a refresher in order to understand and even to give more opinion and idea to our colleagues, especially disciplined colleagues, how to observe and how to know if a person has got mental ill health and how to manage them. And I think in the next one, we'll be able even to involve people like head of securities in order for them to understand better and to be in a position to be able to manage offenders in a better way.
In the Northern Cape, we have very few people who are spread far apart, and we have even less psychiatrists available. So mental health care is difficult to manage when it comes to specialist consultations. So the point of us attending these kind of sessions helps us level up our ability to manage mental health care patients, psychiatric illnesses, and where we need to refer the patients, we are better equipped to refer those patients.
As a pharmacist, there's a lot of challenges with making sure that we have medication to treat our patients and to make sure that they get the same services they would get if they were not in our setting. But in the summit, we really learned a lot, and we are definitely going back to make sure that we put measures in place to make sure that our pharmaceutical services with regards to mental health are provided properly.